Welcome. We as a nation must not only address the out-of-control active duty and veteran abuse of marijuana, opioids, alcohol, and smoking, but also the infliction upon our youth from military service of post-traumatic stress disorder, and the heartbreaking incidence of military-related suicide. I'm Gus Kapler. I served as a trauma surgeon in Vietnam. The following is a plea for the rehabilitation of our nation's warriors. The public conception is that when Johnny or Jane returns from service, they will be the same bright-eyed, engaging youth that enlisted at age 18. Gerald Elario of the Headstrong Project stated, "Everyone expects veterans to return to normal when they return home. But it's only the veteran's body that has returned to safety. The nervous system is still living in a dangerous place." On my first visit to my childhood home, Lake Ronkonkoma, Long Island, New York, after returning from Vietnam in 1971, my mother announced, "Eddie, you have changed." Her evaluation expressed accusation, criticism, and disappointment. Indeed, I had changed. After witnessing war's devastation of body, mind, and soul. I had just served a year in Vietnam as a trauma surgeon. Would anyone besides my wife, Robin, listen to my confession and give me absolution? After millennia of warfare, an ignorance of this change persists, in spite of being historically defined. The 17th and 18th centuries' nostalgia, the Civil War's soldier's heart, shell shock in World War I, battle fatigue in World War II, and delayed stress in Vietnam, and now PTSD. Fact. The mentality of every military inductee and warrior is forever changed to varying degrees. Is it not the responsibility of our nation to accept this predictable change in combatants and institute measures for the veterans' rehabilitation and reintegration into a peaceful society? We from Vietnam were discarded to sink or swim for decades and had to fend for ourselves, resulting in a deplorable panorama of outcomes. The incurred financial, emotional, familial, and societal costs have become staggering. In Task and Purpose, August 2017, Chris Goldsmith of the Vietnam Veterans of America was quoted, "What we need to get past is treating service members as if they are disposable." Most of the 21st century veterans I interviewed agreed that they were sent home to sink or swim. Our nation has accepted our current national travesty of active duty and veteran suicide as the cost of doing business. Some experts now interpret this disgrace as the new normal, as reported in the USA Today, June 2016. What a pitiful cop-out. Why are our warriors' brains incapable of regaining harmony? The major factor is that the average age of current inductees is 22. Their brains are adolescent. B.J. Casey, Ph.D. in 2008, defined the relationship of the brain's prefrontal cortex and limbic system in adolescence. There exists, as a result of a slower rate of maturation in the prefrontal cortex, a lack of harmony due to inadequate executive control over the primitive, dominant limbic system that responds to environmental input and stimulates the sympathetic nervous system and adrenal glands to release adrenaline, creating fight or flight. Colonel David Grossman in On Combat encourages exaggerating the limbic system's power to develop more efficient and effective combatants. His methods have helped to mold the most dominant warriors on the planet and to increase the odds that they will prevail and return to safety. However, unintended adverse consequences have resulted from exaggerating the limbic stimulation. During basic training and active duty, whether or not deployed, a process referred to as neuronal pruning, that is destruction, of established harmony-preserving nerve cells occurs. Protective nerve cell growth is also inhibited. Both these changes exaggerate limbic dominance. Age, stigma, basic training, and being controlled by the military culture are the definitive factors in active duty military suicide, and in my opinion, the development of prodromal PTS and PTSD. As reported by Mark Reger, PhD, in 2015, being deployed and engaging in combat are less influential. In fact, recent research has determined that experience in combat may be protective. H. Lee, PhD, April 2017. The warrior's existence, governed by the switched-on limbic system, is consumed being primed to respond in a programmed manner at a moment's notice to achieve a state of fight or flight. Subjected to the mantra of the military culture and stigmatization, which induces personnel to suck it up and embrace historical standards, the limbic dominance is further enabled. As warriors perceive they are losing control, some, seeking rescue to turn the switch off, will begin to self-medicate with marijuana, alcohol, and prescription opioids. The downside is that the limbic system dominance is enhanced by additional pruning and the slowed maturation of the brain's protective nerve cells. Most active duty personnel do not seek rescue from mental health professionals for fear of being stigmatized. Without rescue, the warrior experiences an insurmountable level of stress, helplessness, and depression. Suicide becomes an acceptable alternative. Without rescue, veterans of all wars lose 20 of their number a day to suicide. To understand what's going on, research must define the alterations occurring in the non-rescued brain at the cellular and molecular levels. This process will be difficult since there is a prohibition to invading living brains for data. However, blood samples from suicide-prone individuals and tissue analysis from suicide victims have revealed some hints. The human species has evolved a default mechanism to respond to environmental changes. The hypothalamus, part of the limbic system, stimulates the sympathetic nervous system, which commands the adrenal glands to release adrenaline and cortisol. Activation of this same mechanism is our body's response to blood loss shock. If the shock patient is not rescued from limbic system mediated, uninhibited sympathetic nervous system and adrenal stimulation by restoration of lost or sequestered water, salt, and blood, hypothermia, acidosis, and oliguria evolve, and death will soon follow. In those with PTS induced by military stress, the hypothalamus within the limbic system, as in blood loss shock, is stimulating the sympathetic nervous system and the adrenal glands to create fight or flight. Van Herregren, PhD, 2014. If not rescued from fight or flight by switching off the hypothalamic stimulation, the development of PTS, PTSD, and in extremis, suicide are probable consequences. The military does not offer effective rescues without the fear of stigma affecting promotion or extension of service to dampen the incidence of PTS PTSD and suicide within the military services. Without rescue, the warrior and veteran exist to sink or swim. Currently, the medical treatment established for PTS and hopefully avoidance of progression to suicide begins with beta blockers to block released adrenaline. Additional pharmacology includes a pill salad of Ativan to calm the patient, Ambien for sleep, and Zoloft for depression. Many of these patients enter a zombie state. A myriad of non-medicinal approaches to PTSD exist. Trips back to Vietnam with Soldier's Heart to engage previous Vietnamese enemies who, due to collective communal support, do not develop PTS. Cognitive therapy, in which one learns to change thoughts about the trauma that are not true and that cause stress. Exposure therapy, in which one talks about the traumatic event over and over in a safe place until one has less fear. Eye movement desensitization and reprocessing, EMDR, in which you focus on hand movements and sounds while talking about the traumatic event. My favorite, founded by Bob Nevins, who flew dust-off missions with the 326th Medical Battalion to my hospital in Vietnam, is Saratoga Warhorse, which is extremely successful in rescuing veterans with PTS by turning off the switch, by engaging them with an off-the-track racehorse. Public health preventive measures ensure good health. Childhood immunizations, the FDA, stop signs, colonoscopies. Why not institute prevention as a rescue to reduce the incidence of PTS, PTSD, and suicide? Save our warriors from the consequences of uninhibited hypothalamic and sympathetic nervous system stimulation. Colonel E. Fruchter, when Chief of Israeli Armed Forces Mental Health, reported the Israeli military culture has changed considerably to accept PTS as an expected result of service, while at all levels condoning psychological intervention without stigma. Colonel Fruchter emphasized the Israeli Army's unit strength in stabilizing the warrior. These men and women share love, understanding, protection, affirmation, acceptance, justification of actions, and their new morality, which floats in a moral limbo, vacillating between that of peace, killing prohibited, and war, killing endorsed. In Welcome Home from Vietnam, finally, a trauma surgeon's memoir, I relate war's devastation on body, mind, and soul, and champion rescue by instituting preventive measures prior to discharge. I propose a therapeutic timeout, utilizing the unit strength, isolating it in a safe place, without record keeping and risk of stigmatization or threat of discipline, to learn that PTS predictably develops to varying degrees, to reconcile their actions and experiences, to verbalize anxieties and fears, to express guilt, to regain their harmony and humanity, and to learn coping skills. The U.S. Air Force has successfully instituted a similar program, the Deployment Transition Center in Ramstein, Germany, resulting in a 40% reduction in veteran PTSD symptoms. As in the Air Force, all our military personnel must be rescued by switching off the hypothalamic stimulation of the sympathetic nervous system and adrenal glands to revive harmony and avoid catastrophe. Rescue allows the rest, relaxation, and restorative functions of the dorsal and ventral portions of the vagus nerve to compromise, to reach equilibrium, and to bring the brain into harmony, Porges, PhD, 2011. The stressed brain will heal, allowing the prefrontal cortex essential control over the expressive limbic system. Pruning will be halted, nerve cells repaired, and the cellular environment will become homeostatic. The neurotransmitters dopamine, serotonin, and adrenaline, and others, will re-exert an efficacious influence, not destructive. A preventive therapeutic timeout will induce this rescue. Accepting that PTSD is inevitable during military service and that prevention of symptoms is possible through a rescue both during active duty and before discharge should induce our nation to take responsibility in rehabilitating and not discarding our currently disposable warriors. Email me at guskapler@yahoo.com to receive a free ebook and a link to Saratoga Warhorse. Visit the book's Facebook page. Please help save our brave warriors that signed a blank check payable to our nation for an amount up to and including their life.